Hello, my name is Erin Hinton, and today I will be presenting a case on septic arthritis. Mr. D'Souza is an 83-year-old male who was brought in by ambulance after visiting his general practitioner where he suffered a syncopal episode while being examined. He presented with increased malaise and painful swollen right knee. Mr. D'Souza has a history of rheumatoid arthritis since the age of 18. On arrival to the emergency department, his observations were as follows. Right knee very swollen, hot, red in color, and pain was 8 out of 10. Limited range of motion to the right knee, temperature 38.7 degrees Celsius, a respiratory rate of 22 beats per minute, a heart rate of 120 beats per minute, and deformities to the proximal interphalangeal joints on wrists and both hands. As Mr. D'Souza has been diagnosed with rheumatoid arthritis since the age of 18, it is most commonly known that he could develop septic arthritis throughout his life. A pre-existing arthritic joint is predisposed to infection. Some of the possible contributing factors include rheumatoid arthritis. It has been presumed that a patient with rheumatoid arthritis, that the phagocytosis, which is the process in which the cell uses its own plasma membrane to engulf a large particle by the polymorphonuclear PMN cell in the blood and synovial fluid, is defective, and this can lead to increased risk of being susceptible to infection. Mr. D'Souza is feeling an overall of malaise, limited range of motion to the right knee. It appears to be swollen, red and hot to touch. Along with his abnormal vitals, this could be a pre-indication of septic arthritis. Mr. D'Souza is experiencing tachycardia and tachypnea. These are both common in the clinical manifestations of sepsis and/or septic arthritis. Tachycardia is a common indicator of sepsis and suggestive in the systemic response to stress. It is portrayed through the physiologic mechanisms by which the cardiac output and oxygen delivery is seemingly increased. Hypovolemia can be indicated from tachycardia and requires the need for intravascular repletion, although adequate intravascular repletion in sepsis may not assist with regulating the heart rate. Tachypnea is not always a feature of someone experiencing sepsis. However, it is a indicator indicator that there is of pulmonary dysfunction with added stress to the cardiac input. Therefore, this is causing Mr. D'Souza to become tachypneic. Mr. D'Souza is febrile. This can indicate that there is a possible underlying infection to some degree. This can be confirmed with routine full bloods obtained. If there is an indicated infection, the white blood cells is generally elevated. The full blood count is also screened for typical inflammatory markers such as the creatinine reactive protein, CRP. When Mr. D'Souza presented to the ED, his blood pressure was recorded as low as 90/50. With the current systemic response in action, the blood vessels can dilate and can cause the blood pressure to drop. Instead of trying to assist with fighting the infection, the body can respond to sepsis by slowing down the normalized blood flow, which decreases the immune system to be less effective. The bacteria that is currently running throughout the bloodstream can damage vital organs and can introduce organ failure. When an infection occurs in a joint as a result of the production of bacteremia, the first point of growth in the synovial membrane or within the adjacent bone. An inflammation of the synovial membrane rapidly increases the leukocytes in the synovial fluid. This particular fluid extends to the fluids within the joint. The fluids would then reveal the etiology of the infection. Mr. D'Souza has deformities to the proximal interphalangeal joints and both of his wrists. This is secondary to rheumatoid arthritis. This is caused by stiffness in the joints and, if not allowing full function, with a presentation of swelling around the joint. Here you can see a normal knee and a knee with septic arthritis, with the incision of an aspiration being conducted. Clinical interventions for septic arthritis can include an arthrocentesis, which is where a doctor inserts a needle into the joint space and aspirates the synovial fluid within the joint. The synovial fluid is then sent off for testing to see what kind of gram-negative or gram-positive bacteria. Once these results are confirmed, the doctor will then prescribe a specific antibiotic to be administered intravenously to assist with managing the infection within the joint. Commonly used antibiotics are vancomycin for post-gram cocci, ceftriaxone for gram-negative cocci, and ceftazidime for gram-negative rods. Mr. D'Souza has presented with the clinical manifestations as outlined. It would be recommended that he obtain a full blood count to determine the specific infection within his knee. He is showing adequate signs and symptoms of sepsis. Possible surgical interventions would be recommended to drain the fluids from his knee and promote his overall well-being. Thank you for listening to my case study on septic arthritis.